Hey everybody, I'm here with Dr. Michael Wierschem at Dallas Men's Health. You can find them at dallasmenshealth.com. So we're here to talk about their treatments for ED and some of the common causes of ED and misconceptions with that. So doctor, thanks so much for joining us today. I really appreciate it.
Of course.
Yeah, and I wanted to start off just by asking how long you've been working, in the men's health industry and specifically with ED.
For 23 plus years, I've been, I finished training in my urology in 1999, and ever since then, I've been working with erectile dysfunction and most men's health issues.
Yeah, that's good to hear. Was there, anything in particular that, drew you towards that, or was it just seeing, how much of a need there was for that?
Yeah, certainly there's a need for it. And I actually, I enjoy helping men with their quality of life.
Mhm.
And it crosses a broad spectrum of younger men and older men, and lots of disease processes that men have that can affect their erections and other men's health issues, their urinary issues and whatever. It's just it's nice to be able to work with these guys and change their lives.
Yeah, definitely. Yeah, and a lot of times, obviously the ED can be, a symptom of an underlying health issue that they definitely need to get checked out for. So it's, as much of an issue as it is, it's good that, we can at least get in there and get checked out for everything else.
Absolutely.
And what do you feel like it is that, most men are, not wanting to talk to their primary care about it, or it's one of those things that they kind of just, mention on the way out the door and, maybe just think that the only options out there are, Viagra or something like that?
I think guys, it's getting better, but men don't like to talk about it, and I try to promote I try to be very approachable on the subject, and I think a lot of my patients appreciate that. And a lot of the primary care doctors don't always address the issue, and the patients don't want to bring it up. So we try to make it easy for our patients. I have a web chat on my website, so patients can just go on there without actually having to talk to anybody. And they can even schedule their appointment that way. We try to be as try to keep things as private as possible for the patients, because I do think that it's a difficult thing to talk about.
Yeah, definitely. I think a lot of our, our ego and our pride is tied to that. And so I think, for a lot of guys, it can feel like, there's something wrong with them. And, I think it definitely helps to let them know there's tons of guys that struggle with it. And obviously there are treatments out there that can really help make a big difference with it.
Absolutely.
And what are some of the main treatments that you focus on there, for patients that do have ED?
Well, as a urologist, we kind of I pretty much offer everything that's available. So obviously there's medications, several different medications that guys can take. That's usually first line, just because they're all generic, so they're all fairly inexpensive now. Most guys don't have many side effects, but if they do, then sometimes we have to try different things. There's vacuum devices that guys can use. Not the most romantic of treatments, but it can be helpful for men. Staying on the conservative side, shockwave therapy can be effective in some men. Platelet-rich plasma, also known as the P-shot, can be effective in some men. When those stop working or don't work, we can advance towards injection therapy, where you'd actually inject something like a liquid Viagra directly into your penis to give you an erection. And then we also do penile implants for the guys that have really, really severe erectile dysfunction. And we actually offer everything here. We don't just concentrate on one thing. We look at our patients, look at their medications, look at their health history, figure out what they've tried, what they haven't, and then try to figure out what's the best option for them.
Yeah, it's good to hear. And is there, specific causes of ED that are best treated with the shockwave therapy and the P-shot?
Well, one thing we know is that not all men are candidates. There's a lot of guys out there advertising for this, guaranteeing great results, and the truth is that that's really misleading. For instance, the studies show that men with severe erectile dysfunction, where the pills don't work, shockwave and PRP is not going to help. Patients with diabetes, they're not going to work. Patients that have had radical prostatectomies and have significant nerve damage, they're not going to work. I discuss this with my patients, and so that they understand that they may come in wanting shockwave therapy, but that's very expensive. And I'll tell them, hey, insurance doesn't cover it. And I'll say, I'll take your money, but it's not going to help you. We should go this direction or that direction. So some guys will have erectile dysfunction that's psychogenic. That's usually a pretty easy fix. I wouldn't use shockwave or PRP for that. Usually it's a confidence issue. Give them some pills. That usually fixes that. Certain medications, like high blood pressure medications, can cause erectile dysfunction. So we have to kind of, the first thing I do before I walk in and even see a patient is I look at their medication list, look at their health history, and I kind of have a feeling for what's going to be good for them just based off of that.
Yeah, that makes sense. And is it just because, the shockwave therapy can't really help if there is, nerve damage or diabetes, or those things that you have to, treat separately?
Yeah. So the nerves can regenerate, but it takes a long time. And so with the radical prostatectomy, they're really getting those nerves way back behind the rectum. And so if there's significant nerve damage from that, the therapies aren't going to be able to fix that. Diabetes is a difficult one, because diabetes not only affects the cardiovascular system, but it also affects nerve, which is why diabetics will have they'll lose feeling in their feet or fingers, because it affects the nerves. And so you need both the nerves and the blood flow to have a good erection. And so diabetes is a tough one because of that. So that's why those two particular issues really are not going to be, you're not going to have success with the shockwave or the PRP with those.
Yeah, it makes sense. And so what are the causes of ED that specifically would be best treated with the shockwave or the PRP?
I think so. As guys start to get older, father time takes over, and things become you get a little plaque buildup in some of the arteries in there, and you start to have mild to moderate erectile dysfunction where the pills work, but sometimes the guys don't want to take the pills. So if you have mild to moderate erectile dysfunction, and it could even be from high blood pressure, those guys are going to be the best candidates. And the problem with high blood pressure is it's usually the medications. So you can sometimes try to switch the medications, but if it's the medications causing the erectile dysfunction, it's not going to work for those guys. So I would say guys with mild to moderate erectile dysfunction, even if they have mild diabetes, you might be able to have some success there. You just want to avoid the guys with severe erectile dysfunction or really significant past medical histories. So usually it's, younger men with mild to moderate disease.
Yeah, that makes sense. And with those patients, have you seen pretty good results with using those therapies?
Well, yeah, now that depends. There's difference. So for instance, with platelet-rich plasma, or PRP or the P shot, not all treatments are the same. The studies show that you want to have at least 7 billion with a B platelets to improve erectile dysfunction. And most of the PRP treatments offer 1 to 1.5 billion treatments, platelets. the product that we use gives an average of 10 billion platelets. So it's important when you're looking at getting PRP, just like size matters, right? Platelets, number of platelets matters. So if you're looking at going to get PRP done, you want to make sure that they're using the appropriate device that spins that down to get the most platelets for that. We use what's called the pure PRP, which is the best one on the market. For shockwave, it's also important what type of device you use. There's two types. There's a focused device and non-focused device. Most people out there, they're offering shockwave use the non-focused device. This device is, they promote it a lot and they talk about the good research, but the research that they're quoting is research that's based off the better systems. The non-focused or radial devices don't even penetrate deep enough to do anything to the tissues. So the other issue with it is it's a they call a FDA class 1 device, and you don't even need medical supervision to use it. You can buy these things off the internet and use it on yourself. So it's important if you're going to have shockwave, it's important to ask those questions. What type of device is it? Focused? Is it non-focused? And the focused devices, there's 3 different kinds: hydroelectric, electrohydraulic, electromagnetic, and piezoelectric. The best one is the hydroelectric. That's where all the studies come from. And so those devices are focused and they offer the best results. So it's important to know that. And I try to on my website, I talk about these things and I try to educate the patients so that they aren't wasting their money going to some of these guys that advertise, because typically they're using the non-focal or the radial device. Again, doesn't even penetrate deep enough to do anything. So if you're having any improvement, it would be a placebo effect.
Sure.
Does that make sense?
Yeah, definitely. And so you said that the studies that they've done have been based off of the ones that you use?
Correct. The electrohydraulic is the strongest device, and a lot of people don't use it because it's a pretty expensive device. It's almost $200,000 for the device, so most people don't use it. But that's, there's most of the research comes off of that device, and the other people, the doctors not using that device are quoting their research of a different device. So it's, like I said, it's a bit misleading, unfortunately.
Yeah,
so
definitely. Because
that's why this is why I'm really happy to be doing this, because I think it's important to educate the patients, because I tell you, because of what I do, because I offer pretty much everything. Usually these guys come see me after they've spent $10,000-$12,000 on these treatments and it didn't work. So they're in my office, and then we can fix them.
Yeah. It must be difficult to be kind of the bearer of bad news with that, but I mean, at least you have that will help them. And on average, how many sessions are you finding the patients typically need to start seeing results?
So with shockwave, 6 should be enough. Once a week is usually, for guys, most guys are working, so you can do it twice a week, but we try to make it, once a week. I usually do it on a Friday afternoon, just they can work and just swing by on the way home from work. It's about a 20-minute procedure, and we usually start with 6, and it takes some time. The healing process to stimulate the angiogenesis, or the growth of new blood vessels and potential nerve regeneration, that takes some time. So we usually start with 6, and then I tell them, let's see how you're doing at 3 months. If they start to notice some improvement, we may do more. If they haven't noticed any improvement after 6 treatments, we move on to the next treatment option. With PRP, With the old system that only uses one, that gives only 1 billion platelets, normally you have to do that every month for 3 months before you start to see results. With our new treatment, I'm having patients tell me that they're seeing results within 2 weeks.
Okay.
And again, the way the PRP works is it's got, we draw your blood, we spin it down, we get what's called the platelet-rich plasma that has the cytokines, the growth factors, the stem cell stimulating factors in there. We inject that into the penis. I put a little tourniquet on there so that it stays in the area to where it will stimulate all the healing, regenerative processes in the tissue there. So the whole entire process takes about 30 minutes. And with our new system, usually we do it once. And if after 3 months or so, if they're noticing some improvement, we might do another one. Or some guys will come in every 6 months and we'll do it every 6 months. Some guys come in once a year. Some guys only need to have it done once. Everybody's different, actually. And again, disease processes, like diabetes is a progressive thing, so they might need it more often if they're diabetic.
Yeah, that makes sense. And so is there, particular patients that are better fit just for shockwave or for the P shot, or do you usually recommend doing them together?
No, I don't recommend doing them together. I can, but it starts to get expensive for these guys. And I usually do one or the other. And I think the P shot actually, in my experience, works better. And it's a lot less expensive. So, for $1,800, we offer the P shot. The shockwave, you're looking at $500 per treatment. If you're getting 6, 8, 10, 12 treatments, you're up to $5,000 pretty quickly. And so I usually recommend start with the P shot, see how that goes. If they want to add the shockwave down the road, we can do that. We usually offer some kind of a discount for that. But I have found that patients are having better improvement with the P shot. So I usually start with that. But if they prefer the shockwave, we'll do that too.
Yeah.
But I have a good conversation with the patient, and like I said, if they have diabetes at all, shockwave's out. PRP is actually better in patients that if they have mild diabetes, they're just taking pills, they haven't had it very long. You're going to see PRP can actually be effective for that. Shockwave is not. And let me just add one other comment here. As urologists, we also treat a lot of Peyronie's disease, and Peyronie's disease is where you have some sort of scarring or plaque buildup in the penis that can cause an angulation of the penis. And I see a lot of patients come into my office and they want to get shockwave. I think there's some stuff on the internet about that. I just want to make it clear that for Peyronie's disease, shockwave potentially can help with the pain, although 95% of the pain goes away on its own. So I wouldn't recommend it unless the pain persists or unless it's really bad. The shockwave therapy is completely useless for Peyronie's disease. PRP has been shown to help improve and soften up the plaque in the Peyronie's disease. So I have been using the PRP because, again, not too expensive, and most guys really would like to try to avoid surgery. And so we're seeing success. There's several of us doing this, and I know one of my colleagues doesn't even operate on Peyronie's disease anymore. He just injects the PRP into the plaque, and he's having excellent results. So, again, it's safe because it's your own plasma, so it's very safe. I've never had any kind of complication, and we're seeing good results without having to be too expensive. And insurance doesn't cover shockwave or PRP, so I think it's really important to have good conversation with the patients and make sure that we're doing the right thing for the right reason.
Yeah, definitely. I think that's good to hear. Yeah, and do you recommend that patients, come in as soon as they start seeing a consistent, decline in function? Is it best to catch it early on?
Yeah, I think so, because erectile dysfunction is is a tough thing. I mean, I've had guys come see me and tell me that, I need to save their marriage, right? Because it can really affect the like I said, the quality of a man's life, and even their spouse,
Sure.
their partner. And so I think I got off track here. What was the question?
Just if they should reach out, early on.
Oh yeah. So
Sign.
so the problem with erectile dysfunction is that, when you start having it, it kind of builds on itself, and then the spouse thinks it's them, and so I recommend that they have excellent communication with their spouse, to make sure that no, it's not them, and let them know that they're seeing a physician about this, and a lot of times, just me talking to them, telling them, everything's okay, it's just stress. A lot of times, and sometimes that helps, and sometimes it's as simple as just giving somebody like I like to use Cialis, daily Cialis, for some of these guys, because if it's in their system all the time, they don't have to worry about taking a pill, waiting an hour, and all that. It's just always in the system. And so I think it helps build their confidence back up. So I do a lot of that, easy, cheap, safe, right? But when guys start getting into their 50s or 60s and they start having erectile dysfunction, and they come to me and they're shocked and amazed that they have erectile dysfunction. Well, one thing that we've learned is that erectile dysfunction can be a precursor to cardiovascular disease, and 40% or more of men that have erectile dysfunction are going to have some type of a cardiovascular event within 10 years. So it's really important that you get in to see about the erectile dysfunction, because it's all about blood flow. And if you're having issues with blood flow to the penis, those arteries are smaller than the arteries to the heart. So if you start seeing issues with erectile dysfunction, and a Doppler study shows there's decreased flow, well, then that's a precursor to potential cardiovascular disease. So I just make sure these guys are seeing, guys don't like going to the doctor anyway, but it's important that they see their doctor, get their blood checked, make sure their cholesterol is good, their blood pressure is good, looking at the family history, make sure there's no significant history of cardiovascular disease. So yeah, you have to really, be aware of that.
Yeah, definitely. I think that's really important advice. And for the patients that are, local to the practices there, what would be the best way for them to get in contact with you?
For me, I like it if they go through they can certainly call. Our phone system is kind of not always very good, but on my website, I have a web chat, and it's not necessarily monitored 24/7, but if you leave a note on there, you can, somebody will usually, answer your questions. I think the website's really good. I have all kinds of FAQs on there for patients. You can actually go through the website to schedule an appointment as well, or you can go on the web chat, drop your name, phone number, email, and we'll have somebody call you within 24 hours to schedule. Trying to get through on the phones we have a pretty large practice, and over the past couple of years, it's been hard to find people to work, to be honest with you. And so we have a lot of new people. And so I apologize about that ahead of time, but you can go directly through the website and make request an appointment through the link there, or just go into the web chat, put your name down there. A lot of guys just say, I'd like an appointment for, I also do a lot of what's called penile girth enhancement. And so a lot of guys go on there and say, hey, I'd like to schedule an appointment for this. And
Sure.
That's perfect. Then I just, boom, then we can call them, and they don't have to worry about trying to get through the phone line. So that's really easiest way.
Yeah, definitely. All right. Yeah. Well, I love the work you guys are doing there. And those were the questions that I had for you. Was there any last advice or anything you want to leave the patients with if they're, struggling with that, maybe considering either the shockwave or the PRP?
I think just asks questions. I think my website is good, even if you don't live in this area. I mean, I have people come see me from all over the country. I had a guy come see me from Dubai last week, and to see me for all kinds of reasons, whether it's penile implants, whether it's penile girth enhancement, because of I offer an entire gamut of treatments where I don't just do shockwave or just PRP. So, but go to my website and look, and I try to educate on there. And it's important, if you're looking at getting shockwave or PRP, talk to the guys locally and find out, as I described earlier, what are they using the good system or not?
Yeah.
They may not want to answer those questions though. But I think it's important. Otherwise, you're just throwing money out the window.
Sure.
Yeah.
Yeah, definitely. That's really good advice. All right. Yeah. Well, like I said, I love the work you're doing there, and I really appreciate you taking time to share the education with us and talk with us today. So thank you so much.
Absolutely. Thank you.
Yeah, of course. Have a great rest of your day. I appreciate it.
Thank you.